Good morning. Welcome to the Healthy Start Learning Network webinar, everybody. Thank you for joining us in the minute of silence before we began. I hope everyone can hear me okay. My name is Maddie. I'm based in London with Sustain at the Food Power program, which I'll tell you a little bit more about in a moment. But before we get to all the nitty-gritty of it, I'm just going to go through a little bit of housekeeping and logistics for anyone who's listening on our webinars before. This might be familiar, but on your screen, what we love to do during our webinars is have the attendee chat in use by anyone who'd like to. It's on the left-hand side of your screen. And so if you can hear me, if you could just type in there where you're listening from, and in honor of Healthy Start this morning, what your favorite fruit or vegetable is, or if you've harvested anything from your own garden, anything that you've had there, if you want to just type in. And that's a great way for people to introduce themselves, to get a sense of where everyone's joining us from today around the UK, hopefully. And then we also just get to start talking about fruits and vegetables right away. Sandra, great to have you with us from Birmingham, who loves gooseberries. Allison's here from Alexandra Rose. Peppers, great. We are getting all sorts of people dialing in from Leeds, Thameside, London, a lot of London, Cambridge, fantastic. So keep that up. I'm glad you guys can all hear me. The other thing to let you know is that we've got an attendee list. You can toggle between that list and the chat. We're very, very open to people using the chat box to ask questions, to share information with other attendees. It's public, everyone can see it. But I also will always try to repeat the questions out loud because the webinar will be recorded along with the slides that you can see. And so that way anyone who listens in can know a bit about what's happening in the chat. So don't be shy to get in there and share your info if other people are working on similar things or in similar areas to you. It's a great opportunity to connect with other people. At the top of your screen, there's also a button that says Ask a Question. It's green. If you can use this if you'd like, but it will send the question to me privately and the other presenters as well. So if there's something that you want to ask that you don't want other people to see, that's fine. But generally speaking, we encourage the use of the chat just because most people benefit from seeing other people's questions. As I mentioned, we are recording the webinar. What we'll do is at the end of this, we'll email it to everyone who's registered for the webinar. There was about 155 people who registered today, so it's quite a popular one. But we know that not everyone who registers joins, so we always send that link to everyone afterwards. And we will also put it on the Food Power website that you can direct other people to if you think it would be useful for them. So great. A lot of people loving avocados as well this morning. So fantastic. It's so good to have everyone with us. So I just wanted to share a little bit about Food Power, which is the program I work on at Sustain. We're a UK-wide program. We're delivered in partnership between two charities, Sustain, based in London, and Church Action on Poverty, based in Manchester. And we're funded by the Lottery Community Fund. The aim of Food Power is really about strengthening communities' ability to reduce food poverty by tackling its root causes at the local level. So we work with around 50 local partnerships. We'll be hearing from 2 of them today, what we sometimes call alliances or food poverty alliances, and they're based all over the country. So over the last 3 years, we've set up peer learning networks to develop and to share solutions among these areas. And we also offer as a program some financial support for these members. We have set up regional learning networks, peer mentoring, a lot of online resources and toolkits, advice, and these webinars. I'd encourage you to check out our website. My colleague Simon might just drop that link in the chat right now. If not, I will in a minute. Today's meeting on Healthy Start, we actually scheduled this quite a few months ago as part of one of our regional learning networks for the Southeast, London, and East of England, which is coordinated by 2 of our peer mentors, Emily O'Brien from Brighton and Hove, as well as Sam Dyer from Cambridge Sustainable Food. But given the COVID-19 outbreak, we decided, of course, to shift that online and then to open it up much more widely to all of you and evolve the format to fit both the online platform and a few recent updates to the scheme. So we're very, very thankful for Joanne to be joining us today to give a bit more background to that. So this morning, we've got the 3 speakers who are joining me. We have Joanne, who's from the NHS Business Services Authority, then Gemma from Cambridge Sustainable Food, followed by Emily from Brighton and Hove Food Partnership. So each person has a few slides prepared and a short presentation. Then we'll open it up for questions. So I'll keep an eye on the questions while the presenters are speaking. So feel free to type them in as you think of them. And then I'll summarize those questions at the end of each person speaking. So they won't need to read the chat while they're speaking because it's very distracting. And we'll do a little Q&A and then we'll move on to the next speaker. So if you have any questions, let me know as we go along. Joanne has dialed in by phone, so she won't be able to see the chat. But I will, again, be watching those questions, but she's already on the line with us and is just going to let me know when to move the slides along. So I think on that, we will go over to you, Joanne.
Thanks, Maddie. Hi, everybody. I'd just like to start by saying thanks for inviting me to do a little bit of a presentation around the digitisation of the Healthy Start scheme. So first of all, I just want to cover what sort of things are going to be changing, and where possible, I'll tell you when they'll be changing. So first of all, it's the responsibility for the delivery of the service. This service will eventually pass on to the NHS Business Services Authority, and we will have overall responsibility for application processing and provision of the funds. We currently have the contract management responsibility of the current suppliers, so those are the people who issue the vouchers and reimburse the finances to the retailers. The plan is, as we digitise the service, the current voucher scheme will continue to run. So there will be a short period of time where there'll be two services running in parallel. The application process, some of you may already know that there's already been a bit of a change to the application process where the requirement for a health professional signature was removed. That was removed on the 6th of April, so any beneficiaries now just need to get a form. They don't need to get a health professional to countersign that. Where the NHS BSA are working on implementing the digital online application, and we hope to have this ready later on this year. Private beta we hope to have up and running in July, and we'll be looking to start increasing the volumes by October. We'll also be offering an assisted digital application route, and that will be facilitated by the contact centre in the Business Services Authority. We will eventually start to phase out paper application forms. We're not sure when we'll start to phase those out, but hopefully I'll be able to join another one of these sessions in a month or so's time and give you a further update on that. The payment methods are going to be changing. As you know, beneficiaries currently receive vouchers to spend in the registered retailers. So we're going to be introducing a prepaid card. Entitlement will still run on a 4-weekly cycle. So every 4 weeks, the beneficiary will receive their next entitlement loaded onto the card. The prepaid card offers the beneficiaries the opportunity to use more retailers. So with the current scheme, there's only those retailers that are registered for the scheme who can actually accept the vouchers, where the prepaid card retailers who simply just have to have a chip and pin machine in the store will be able to accept the payments. We will be whitelisting retailers, so obviously only certain retailers will be able to sell their products, and the products will remain the same. So, for example, Amazon, Netflix, they wouldn't be allowed to accept the Healthy Start prepaid card. We're looking into 2 further payment methods so that we can meet all beneficiaries' user needs. So, for example, we know we've done some work with Scottish Government on the Best Start Foods scheme that they have, and we know that there are some beneficiaries who live in rural areas where maybe their local shop doesn't actually have a chip and pin facility, maybe down to just there isn't a need for it, or it could be down to internet connections. So we're investigating other payment options for those beneficiaries. The allowed food items, I'm not sure if you are all aware, but as of the 1st of October this year, there will be some additional items added to the allowed food list, and that will be canned fruit and veg is being added, but that's only fruit and veg that's in its own juice and water, can't have any additional fat, salt, sugar or flavourings. Another addition to the list will be beans and pulses. So this is fresh, dried or canned beans and pulses. Again, not with any added fat, salt, sugar or flavourings. And the types of beans and pulses we're talking about here is like lentils, peas, chickpeas, all of that sort of stuff. The branding will be changing. So I'm sure some of you guys are familiar with the stick figures. Maddie, could you move on to the next slide? The next couple of slides have got just some visuals on what proposed branding. So the first one that you can see is the proposed prepayment card. As you can see, it's quite clear what food items are allowed. The next slide is some of the communications and marketing materials that we've had mocked up. We do plan to promote Healthy Start via the NHS-BSA social media sites. There's examples there of some of the posters that we're looking at. Again, the theme of the fruit and veg, the little icons, is going to run through all of the branding that we have. The next slide, this is kind of where I'm coming to you guys with my begging bowl. Obviously, it's a huge scheme. We are aware that out of all of the beneficiaries within the country that could apply, we only have around about 51% of those people actually applying and making use of the benefit. So we're trying to promote the scheme. In what we'd like from you is, we'd like you to tell us about your users. As you can appreciate, COVID-19's had a tremendous impact. We're really struggling with user research because we can't get out into the community to ask people what they need. So if any of you guys are able to help at all, if you can help us, inform us about your users, can you put us in touch with people who currently use the scheme, or anybody who you think doesn't use the scheme but maybe should be using the scheme? It would be great if you could get us in touch with these people. The other thing, what changes would you like to see made to the scheme? We'll be working in conjunction with the Department of Health and Social Care, and hopefully any findings that we have and any improvements that we think we can make, we'll be sharing with the Department of Health, and we kind of have the ability to try to help inform any regulation changes. We also want to know what we can do to help you, because I'm kind of hoping that you guys will be able to help us promote the changes to the service. But we need to understand what you need from us in order for you to help with the promotion. And lastly, yeah, like I said, we would really like you to help us to promote the changes in the service. If you are interested in working with us, or you've got any questions at all about any of the upcoming changes, or if you've got any ideas, there's an email address there that please feel free to use that, send any questions at all, and we'll answer them as best we can. And that's it from me, Maddie, unless any questions popped up.
A few did. I will say there are quite a few that have come through, Joanne. So I've just made a note of them, and I'm going to just Well, we'll go through them as people are coming in. I've just got up till Rachel's. I'll start there, and then we can see where we're at. So the first one was, I think you said this, but just to make totally sure, someone said, can you update when we can apply fully online? And you said, was that July that you said?
July will be starting private beta, so that just means a handful of selected users, and that's just for us to make sure that the online application is working correctly.
Okay.
We have to transition the current users who are using the current service into our service. So we'll be doing that in tranches. The first group, the first cohort of users that we're looking to extend out to will be those people who are in receipt of child tax credit. And the reason for that is we receive data from HMRC and DWP, which helps us to find the people who are entitled. It helps us to check their eligibility for the scheme. And the data feeds from HMRC are going to be ready in August, September time. And the plan is that the prepaid card will be ready in October, so we'll be ramping up the volumes in October, but it'll be child tax credits beneficiaries first.
And one person just asked, will current beneficiaries be automatically transferred over, or will they need to reapply? And it sounds like they will be automatically transferred over, but just slowly in different ways. That's what you're saying.
No, they will have to reapply because of the number of changes to the scheme. It's kind of being looked on as a brand new scheme, and regulations state that an application would have to reapply.
Okay.
But we will be sending notifications to people explaining how to apply and kind of sending links for them to make the application process as simple as possible.
Okay. So, so we'll just recap: private beta testing in July, but with more full rollout in October.
Yeah, we'll be starting the wider rollout in October.
Okay. One question that's come up is, why isn't it automatic that people get Healthy Start vouchers when they register for other benefits?
Good question. Unfortunately, that's not a question that I can answer, because that more sits, I guess, with the Department of Health and Social Care.
Okay. That's more of a policy question than a digitization question.
Yeah. What we're looking to do with the NHS BSA, we process applications for low-income scheme. So if anybody's familiar with an HC2 or an HC3 certificate, we process applications for maternity exemptions, which gives pregnant mothers their free prescriptions and evidence for their free dental treatment. And what we hope to do is kind of follow suit with what the Scottish Government has done with our Best Start grant. So what we're aspiring to do is have just one application into the NHS BSA, and with the information that the users supply, we will be able to then kind of just automatically issue whichever exemptions they are entitled to. So, for example, you could have a family who are on a low income with a pregnant mum, inputs all of the information that we need, and they would automatically be assessed for the low income scheme, the Healthy Start scheme, and the maternity exemption scheme. And so that would mean they would just having to apply once. But that won't be anytime soon. That's a little further down the line.
Yeah. Okay. One person's asked if the new card will be available for use with online shopping.
We haven't made the final decision on that one. There's a lot of pros and cons with online shopping, and that's one of the things that we're working with Best Start Foods. they're kind of giving us some information on their user journeys and how their users are mainly shopping.
Mm-hmm.
So that's kind of a watch this space.
Okay. Okay. A few people have mentioned that. Well, I guess one question is, Victoria said, if it can be used at any retailer with a chip and pin, how will the retailer know the items the person can use the smart card to buy? And what would stop a service user buying something that isn't on the food list if the shop was happy to sell it and for it to be bought on the card?
Yeah, this is where this new service is kind of changing the responsibility for the shopping, where current service, the responsibility is on the retailers when they're being handed the vouchers to check that the valid food items are going through the till. The onus now will be on the beneficiary. So it's set out very, very clearly what the foods are. There's terms and conditions that have to be agreed to, that they will only use the card to buy the specified items. There's things that we can look into to try to track. We can't track the food items for definite. I think there's only one retailer who has the technology in place to be able to do that. But we can, like I mentioned earlier, we can whitelist the retailers. So there's only those that sell the listed items are allowed to accept the card.
Okay. Okay. We've had a few questions come in about the value of the voucher. Do you know of any plans to increase the value since it hasn't changed since 2009? So a few people were
Yeah.
asking if there's anything in the works on that.
As far as I'm aware, there isn't any changes in the pipeline just yet. However, I'm not sure if you're aware that Scotland changed their voucher amount. So the changes that Scotland made to their scheme, they increased the weekly voucher value from £3.10 up to £4.25 a week.
Mm-hmm.
But they reduced kind of the length of entitlement. So where Healthy Start, it would be £3.10 up until the child's 4th birthday. With Best Start Foods, it's £4.25 a week, and it's up until the child's 3rd birthday. So I don't know that, there may be evidence that Best Start Foods change in voucher value and length of scheme works well, and it may be something that we follow suit with. But at this minute in time, I'm not aware of any changes to the voucher value. Personally, I would like to see it increased.
Yeah. I'm sure that's what a lot of the chat is coming through. That many other people would 100% agree with you.
Yeah.
Some people are asking about the vitamins. Is there any change to? Sorry, American, obviously. But is there any change to that scheme as a part of this digitization?
Yes, there is, but the only change is the way that where currently the beneficiary receives a voucher to receive their vitamins, the beneficiary will receive some sort of digital notification or evidence that can be used to collect their vitamins. So there's not a great deal of change in the vitamin supplies.
Okay.
It's just the evidence that they will be shown that entitles them to the vitamins.
Okay. One person, I think you've said this, but just to make sure that it's clarified for Rachel, she said, "Will the name be changing from Healthy Start and the NHS logo branding will be used? I thought one of the digitalization updates said it wasn't going to be included, but just to confirm, it will still be called Healthy Start. It's just the branding will change to some of the stuff that you put on those slides with that sort of blue and green colors and stuff."
Yeah, it'll definitely have the NHS logo on there. The online application will be called Apply for Healthy Start. There was a lot of work done before the NHS BSA got involved with the digitisation programme. A lot of work done with GDS, and So, and they advise to you name the online application element of the service, apply for Healthy Start. Healthy Start will always be kind of there because there's so many beneficiaries who recognise the name Healthy Start. So we don't want to totally change the name of the scheme.
Yeah.
A new name might be beneficial to new beneficiaries, but for the 350,000 who are currently on the scheme, they may not understand that the scheme's changed. So the plan is Healthy Start will always be part of the name.
Yeah, that makes sense. I think that sounds like a smart move. So one person asked if there's any training for retailers around the purpose and scope of the scheme, like a short online module. Do you know if there's anything in the works on that?
The one, I wouldn't say training. We are pulling together some retailer packs, but obviously, as I mentioned before, COVID-19's kind of impacted our user research, and we really wanted to spend some time with some of the retailers who are currently registered with the scheme. So if there's any retailers out there who would be happy to kind of speak to us and tell us what it is they would like in the scheme, in the pack, or what do the retailers need from us to help them understand the changes in the scheme, then please, if there is any retailers out there, get in touch by that email address.
Okay, great. Because there's a few people who have said that they work, for example, this is sort of related, but for example, Chantal in Croydon mentioned that she works with a number of community food shops who don't accept chip and pin, but are registered Healthy Start retailers. So maybe people who are in similar situations could get in touch to feedback their experiences working with retailers who don't
Yes.
accept that, and as well as market stalls potentially. And just to confirm another question that came in, Barbara was asking about the timeline for the introduction of the prepaid card. And will this be rolled out in the same timeline as the online application form? So beta testing in July, but a larger transfer of people starting in October?
Yeah, the card, we expect the prepaid card to start going into circulation in October.
Okay. Okay. Someone asked about eligibility criteria and about the unequal eligibility criteria between the child tax credit and universal credit. Do you know if there's anything in the works to address that?
Not that I'm aware of, but that's a policy question, so that isn't really anything that I would be able to comment on.
Yep. Okay. Um, and if families do fail to reapply, this is another one coming in from Carol. If families fail to reapply, will their current entitlement stop during that transfer period, or will it happen over a very long time?
It'll be a gradual transition,
Mm-hmm.
and there will come a point where the current supplier just does not issue any more vouchers, but will be constantly kind of reminding beneficiaries that the current scheme is coming to an end, and if they want to continue receiving the benefit, they'll have to apply to the new scheme.
Okay. In terms of the card, another question that's come through. So, Natalie said, "How does it work when doing a weekly shop? How will using the prepaid card deduct the amount for allowed food?" I know you guys have been doing some tests around this. Could you say anything more about that?
Yeah. What would have to happen with that? The user would have to put the Healthy Start items through and pay with. They'd have to kind of do it almost as two transactions in the shop.
Okay.
Does that make sense? So you'd have to have your Healthy Start items and pay for those first, and then get the rest of your shopping put through.
Okay. And I what I've heard, which is something I know will be quite welcomed, is that the card. It's not that you have to. Previously, with the paper vouchers, if you spend £3.10, or if you're buying something for £2.80, but you use one voucher, you don't keep that 30p that's lost, for example. But in this case, it will kind of roll over. You can spend as much
Yes.
as you want off of the card on each shop, and they'll be topped
Yes.
up every 4 weeks. Is that correct?
Yeah, every 4 weeks. So that stays the same. Currently, the vouchers get posted out every 4 weeks, so the top-ups will be done on 4 weekly cycles.
Yeah. And there's no registration process for retailers to accept those cards anymore.
No, the only requirement really from a retailer is that they have a chip and PIN device.
Right, right. And will in the current process, someone's brought up the point that you register when you're pregnant and then you have to apply again once the baby's born. Will it still need to be that double registration, or will it continue after the pregnancy?
We plan to continue straight on. Obviously, what has to happen? Say, for example, if somebody is under 18 and pregnant, they'll automatically qualify. Once they've had their child, it depends whether or not they're entitled to any of the benefits. So the under 18 pregnant user, that's slightly different, but on the whole, if somebody's entitled to any of the benefits and pregnant, we expect once they've had their child, they will just remain on the scheme because of their benefit entitlement.
Okay, so if they're under 18, they will stay on the scheme after the baby's born. But if they're over 18, no. Okay, so they
No,
still need to apply.
So if they're under 18 and that they qualify for the Healthy Start because they are under 18 and pregnant, that's that qualifying criteria.
Yeah.
Once they have their child, if they're still under 18, they'd only be entitled to continue on the scheme if they also qualified for one of the qualifying benefits.
Right, okay.
Wherever possible, we will maintain people on the scheme as long as they still fall into one of the qualifying criteria. They will remain on the scheme. We don't want users having to keep reapplying.
Right. Okay. So it sounds like in the new setup there won't be a requirement to reapply after birth.
No.
Okay. That's very exciting. I'm sure people will be very glad to hear that, because I know that was one of the obstacles people didn't that many people struggled with. Um, there's a few more I'm hoping to get through here, if that's okay. One person asked about the assisted digital process. If you could say a little bit more about what that might look like.
Yeah, absolutely. So with assisted digital, there's kind of two different ways to do assisted digital. So you've got your first, where maybe you've got someone who is not very confident filling in online applications. They would ring our contact centre. If they have access to the online application, the contact centre agent will talk them through the application. So the beneficiary is still applying digitally, just getting a little bit of help going through the process. The other assisted digital option that we offer is if someone is really not comfortable with online and the whole technology bit, or they simply don't have access to it, the contact centre agents will be able to take their details and apply on their behalf. So the contact centre agents would be adding all of the beneficiary details to the system.
Okay. So there'll be a phone number that people can call to help do that over the phone instead of online.
Yes.
Yep. One person has asked when the new branding will be available, or when you're planning to roll that out publicly.
Okay. We don't plan to roll the new branding out anytime soon, and that is just in case, because obviously it's new branding, people see new posters and everything pop up, that it kind of spikes a bit of interest, and we don't want to open up the floodgates for a lot of people applying whilst we're in private beta, because the private beta phase is so that we can do a lot of learning and refine the system. So the plan is we might drip feed some of the new branding. We wouldn't be looking to kind of share it much wider until October.
Okay. Okay. One person just asked a quick and just to I'm just trying to clump the questions here as much as I can, but it's a little bit tricky because there's quite a few. But the um, the phone line that you mentioned for the assisted, will that be free to call?
Um, I'm I'm not 100% sure. I'll have to come back to you on that.
That's fine. You're welcome to not know all of the answers. You're getting a lot of questions right now, so I really appreciate you helping
Yeah.
tackle these. Go through a few more if that's okay. I'll just get through the ones that I currently have on my list, and then we'll pause there because we've got to get on to the other speakers as well. Um, uh, Someone else asked about eligibility. Is that still going to be beginning at 10 weeks of pregnancy?
Yes.
Okay,
Yeah,
great.
that hasn't changed in the regulation.
Okay, great. I didn't think so. I just thought I'd just double check out loud. Um, One other question was, if the emphasis is on the beneficiaries, what are the consequences if people do buy items they shouldn't? Is that something that's come up at all?
Yes, it has, and it's a risk. And if it's found that people are using the card fraudulently, then the benefit can be removed.
Okay. Yep. On that note, Rebecca's asked, she said, quote, am I right in thinking retailers will be able to identify recipients at point of sale based on accepting cards, but won't be able to track sales of food or match fund, for example?
Well, sorry, can you repeat that? Because I'm not. Do
Yeah,
you mean?
I think
Do you mean that the
when
till operator would recognise that it's Healthy Start because it's a Healthy Start card?
yeah, I think she's what she's wondering about is will the retailers be able to track which items are purchased? Um, they could say like how many people were buying, what percentage of the sales were to fruit or vegetables or different categories in store. Do you know if there's any like tracking ability, I think, within that
Right.
prepaid card system?
As far as we know, there's only one retailer who has that technology. That sort of information for all we could see through the cards is which shop the card's being used at,
Hmm.
the date of the transaction, and the cost of the transaction. We won't be able to see it broken down into individual items that were purchased. As far as we understand, there's only one retailer who has that technology within their stores. So
Okay.
it could be that, if retailers were looking to introduce that technology, that would be great because that would help us. But obviously, we're not putting any onus on the retailers to do anything like that.
Yeah, that makes sense. I know the point of sale technology within every retailer can vary, so it's hard to implement that
Yeah,
at the level you're working at. But the more that they have in store that might be able to be used for this, the better. It sounds like.
yeah.
Okay, I think we're going to wrap it up there. I'm just going to make sure that the two main takeaways that I think have been incredibly useful to find out here are that the beta testing is starting in July, which will be with small groups of people to make sure the system's working. There'll be more transfer of current beneficiaries starting in October with a slow rollout of branding to go alongside with that. Um, but the full online application form will be available publicly in October as well for new beneficiaries. Is that correct?
It will be open for new beneficiaries who aren't currently on the scheme but who are in receipt of child tax credits.
Okay.
So we have to roll it out in groups of user types.
Okay. Okay. So the come October, it'll be the transfer process will begin, and those who are eligible via for a Healthy Start via child tax credits will be the first group to be able to apply online. But it sounds like the full online application or the online application form for anyone to apply who's eligible won't be available until later, sometime beyond October 2020.
Yes, that's right.
Okay, great. As long as it's just good to make sure we have that super clear for everyone who's listening in. And just to clarify, a few people who have asked about this, there's not the ability to bar certain things being used on the card using the prepaid card, because so it'll be a system of trust between the retailers and the recipients.
Like I mentioned earlier, the onus is on the beneficiary to spend the card on the allowed items. We can't configure the card to prevent certain items being purchased. We can only configure the card to prevent the card being used in kind of blacklisted retailers, if you like.
Right, like you said, like Netflix, for example.
Yes.
Yeah, exactly. Okay, and then the other thing that you mentioned that I just want to make sure we've got totally clear is that if you apply during pregnancy, and you give birth and you're still eligible after giving birth with the same criteria as before, you won't need to reapply after the child is born.
That's the plan. Yes, that's definitely what we're working towards.
That is the goal. So there will not, in theory, hopefully, you won't need to reapply after giving birth.
No, that's absolutely not what we want. We want to make this as easy as possible for the beneficiaries. So in an ideal world, they'll apply when they're pregnant, and if after the baby's been born, they're still entitled to any of the qualifying benefits, then they will just remain on the scheme.
Fantastic. Thank you so much, Joanne, for answering all of these questions. Thank you, everyone who's listening in for asking all of these questions. What I'm going to do, Joanne, for your benefit and other people, I might type up some of them and maybe some of the responses. And there's also been a number of people in the chat who have said they'd love to get in touch with you, Joanne, about that testing and getting feedback to you. So I'll make sure I gather all those contact details and get them to you. And there's a number of people are writing in just to say thank you so much and how helpful this is. They're like flooding in right now of the thank yous, which I know you can see, but I just want to let you know. So we're now going to go over, and I can just send you the transcript of this so you can see what came in as well from various people. We're now going to move on to Gemma from Cambridge, and then we'll hear from Emily in Brighton and Hove, and we'll keep moving on. So thanks again, Joanne.
Thank you. Thanks, everybody. Just get in touch if you can help.
Great. And I'll just mute your mic now, Joanne, so if you want to just take a breather.
Okay, I'll make a start. I'm Gemma from Cambridge Sustainable Food. We've been a food partnership for about 5 years now, and I just wanted to give you a bit of background about the work we've been doing in promoting Healthy Start through training midwives, and also a bit of work around raising awareness in the community and with our local retailers. So, to just give you a little bit of background about Cambridge, Cambridge often perceived as affluent through and through. However, it's been ranked for the second year running as the city with the highest level of income inequality in the UK. We've got a 9-year gap in life expectancy in some areas. And some areas of Abbey and King's Hedges in the north of the city are among the 20% most deprived in the country. Rents in Cambridge are high and escalating, and food bank and holiday lunch use is increasing. We know that about 1 in 5 children in the city is at risk of poverty. We've got some real hotspots in those areas I mentioned earlier. A third of children in the Abbey area are at risk. In terms of Healthy Start, we know that around 44% of eligible families are missing out on the vouchers. And as a result, this has really galvanised a lot of work in the city, putting together our Food Poverty Alliance back in 2018 and publishing our first action plan for 2020 to 23. One of the targets within that action plan is actually to try to increase Healthy Start uptake to 80% by eligible families. So we've got quite a long way to go, clearly. So our most obvious place to start, and this is work we did probably about 1.5 years ago, was to really start trying to get this message out about eligibility for Healthy Start. So we produced a poster, which you can see on the screen, which we distributed out to our partners, agencies, the City Council, hospitals, family centres, churches, and many others. So I think we've distributed about 350 posters so far. So if anyone wants a copy of this, really happy to share it. So that was kind of the easy thing to do, which we think had, a decent impact. But we really realised that we wanted to work harder and to understand what was going on with health professionals, to see what their understanding was, and to see if we might be able to improve that if it was needed. So through funding from VPower, we were working to really deliver training to midwives to try and increase Healthy Start uptake. So we first of all chatted with senior midwives at Cambridge University Hospital, so Adam Brooks, and proposed to them a quiz-style questionnaire as part of their Cambridgeshire area quarterly meeting of midwives, so around 40 midwives attending. Of those midwives attending, around a third had been practicing for around 20 years. There were also some newly qualified midwives in the group. And essentially, we kept it quite bright and breezy. We sat down with them and talked about what we were trying to do and why it was important. And then we passed out a questionnaire for them to have a go at, which was a series of multiple choice questions, but also some open questions to find out a bit more about their understanding of the scheme. It didn't take long to do, and it gave us some really interesting insight into the level of understanding. So it really showed that regardless of where the midwives were in the county, there's a real lack of knowledge around the scheme, especially the eligibility criteria and the application process. For example, 80% of midwives thought that women could claim Healthy Start vouchers if they were unemployed, even if they didn't receive benefits. Another half thought that women who were single mothers also automatically qualified for the scheme. And a tenth of midwives knew that the vouchers could be claimed from 10 weeks. Most were slightly confused about the timing of the benefit being available. Lots of people weren't clear about backdating and what they could do and what they couldn't, and others were unsure about what could be purchased. So there was a lot of questions that this process raised, and as a result, midwives said that they actually felt pretty unconfident in terms of promoting the scheme, and 90% of the people we spoke to were actually eager for further training. So this was a really useful exercise to gain the kind of baseline data to see where we are. As part of that training session, we talked through the scheme in detail, answered questions, gave them an information sheet to take away. So we feel that we've done quite a lot of good work with that group. However, there's loads of other health professionals that we'd like to reach, and we've actually been lucky enough to receive funding from Cambridgeshire Community Foundation this year, which will allow us to extend that programme to health visitors, but also out to community leaders, other partners in our partnership, to really encourage people to get a full understanding of what the scheme is so that they can direct their beneficiaries onto the scheme. We'll be also producing resources for them to use and refer to, and we're looking at trying to ensure a legacy to the project through asking the organisations that take part in that training to include the information about Healthy Start as part of their staff inductions, their handbook, or maybe even to try and put some train the trainer sessions together. So we really hope this project, which we're running for the next 6 months, kind of COVID-19 permitting, maybe online, will help to really improve the uptake of Healthy Start in Cambridge. We're really happy to share the questionnaire that we did with the midwives, or happy to have a chat with anybody in a bit more detail about what we did. And just to talk briefly about some other work we've been doing on Healthy Start, which is really about targeting communities and local retailers. We've done a number of different things here. So we've run cookery activities in some of the low income areas of Cambridge, tied in with the holiday lunch programme. So we've had a good footfall. We used ingredients that could be used, that could be bought with Healthy Start vouchers. So things like vegetable bugs and fruit and milk smoothies. It was a really nice way of not only working with families to improve their food prep skills and learn about healthy food, but also it gave us the opportunity to talk to those parents about Healthy Start and to really find out a bit more about their situations and to direct them to further resources if they needed it. As part of those sessions, we had a stall with some information and the Healthy Start forms, and we could help them to fill those out if that was needed. We took that stall out also around different community events in the city, so it got a good airing last year. As part of that project, we also did a targeted mailing campaign. So we sent out 500 Healthy Start booklets and application forms to households in specific areas in more deprived parts of Cambridge. We really sort of zoned in on the area that had a high level of eligibility, but a low level of uptake. And that campaign we think was successful. We managed to, overall as a result of the project, increase the uptake in our target postcode by 5%. So not huge, but we felt that was a decent level of increase. And finally, we also did some work to engage parents and families around Healthy Start. We ran a Facebook campaign which really focused on getting information about the scheme out, but as well as trying to make it fun, putting some recipes in there, some family-friendly stuff, some fun posts just about family life to try and attract a wider audience. We were able through the campaign to actually answer questions from parents, and we really maximised it through promoting through some of our partners, primary schools, nurseries, Cambridge NCT groups, the city and county councils, as well as the other agencies. Boosting the campaign through advertising on Facebook also seemed to be beneficial, and it ran for a month in October last year and engaged just over 2,000 people. Last part from me, we've also done some work, as I'm sure many of you have, around targeting retailers. So as part of that project last year, we chatted to the 20 or so retailers in the city that weren't yet signed up. A number have since registered, which is fantastic. We also created a map on our website, and we used it on our stall as well to make it obvious where people could go to spend their vouchers at retailers in the city. So I mentioned that we, as part of that project, we got an increase of 5% in uptake in Healthy Start. We found that actually through that process, it was quite hard to find the people that were eligible for Healthy Start but weren't already signed up. So I think there's some more work we'd like to do in terms of targeting through our agency partners. It was also quite nice in terms of retailer engagement because we were able to talk to them about the scheme, but also a bit more about food poverty in general in Cambridge. And I think it's actually led to some interest and hopefully some future work with some of those retailers in terms of supporting food poverty work, particularly through COVID-19. So we'll be continuing to target retailers to try and get all of them signed up, although if the scheme is changing, that may not be so relevant later in the year. And we'll be doing some more work with midwives, health visitors and other community leaders to help increase their knowledge around Healthy Start. Thank you.
Thank you so much, Gemma. It was really interesting to hear about some of the details of it, and we had some good questions coming in. What I think we might do for time is we might pass over to Emily to do her presentation, and then I'll collect questions for both of you to do right at the end, if that's okay. So for now, we'll go over to Emily, but keep them coming in the chat, everyone, and I'll keep making a note of them. Thanks.
Hi everyone, thanks Maddie for inviting me on. I'm Emily O'Brien from Brighton and Hove Food Partnership. I'm just going to do a few really quick slides and then we'll take questions for us and for Cambridge at the end, as Maddie said. Here we go. Sorry, it's a bit of a lag on changing the slides. Here we go. So our Healthy Start campaign has taken place over about the last year. Slightly less, and it built on a previous 2017 campaign, which interestingly I saw somebody had asked in the chat about take up. We actually found that take-up did increase quite substantially following our 2017 campaign, but it took a few months for that to appear. So initially we thought it had made no difference, and it was only when we looked at it later, there's a bit of a lag, I think, in terms of messages getting through. So we very much built on the comms plan that we had for that campaign, and we very much built on the cross-sector working that we developed for that campaign. So we have a cross-sector early years steering group, in which children's centres play a particularly important role. They're really the kind of gateways in our city, but also public health and the CHOMP, who run our holiday, I hate the words holiday hunger, but our holiday activity scheme in the city for families on free school meals, and a number of other partners. So we did some public facing stuff as part of that comms campaign. So we did a social media campaign that was quite successful through Facebook and through Twitter. We did a kind of bit of press. So this photo is from a kind of soft launch. It was actually, it was all done on a bit of a shoestring. So it was part of our AGM, but we did a kind of photo call for that, and that went in the local paper. And we did some blogs. So we bigged up one of our children's centre receptionists who played a really key role. As I said, children's centres were the gateway. So anybody who might struggle with filling in a form and getting the health professional to sign it, so pleased we don't have to do that anymore. They could go into a children's centre, and we funded it through, we had an additional 5k of funding through Food Power, but actually most of that money really went on a few materials and on staff time. And the previous campaign we did in 2017, we did with no funding. So there's quite an emphasis on sort of free stuff. So one of the key things we did spend a little bit of money on was on a locally branded poster, which we have since shared with other areas. And I noticed in the chat with Cambridge, there were a few questions about the poster. And Cambridge based their poster on our poster. We were happy to share that with people. So get in touch if you'd like to be put in touch with our designer who designed it, who could perhaps do you a redesign, or just make contact if you'd like to use that. I think I had to put Cambridge in touch with the designer to get hold of it in a format where somebody else could work with it. So we did quite a big poster campaign. We distributed well over 1,500, and that went on all the city's buses, in all the schools, in all the pharmacies. It went digitally as well. So we did a little version that can go on those screens in GPs and in all the libraries, also through all our community partners, the food banks, the women's centres, the community centres, and in our own work and the work of all our partners, really. So that was the kind of public facing side. It was social media and posters. And then the other things we did were more behind the scenes type stuff around working with partners to embed Healthy Start within existing practices. So for instance, the health visitors, the Community NHS Foundation were really important partners. They made sure that Healthy Start, it's not a very good photo, but you can just about see there's a Healthy Start sticker that went on all the red books in the city. The Family Information Service, who do a lot of signposting and guidance, have embedded Healthy Start really within their signposting. Children's centres, as I said, played a really key role, and anybody who was waiting in a children's centre reception could ask the receptionist about that. We had the piles there, we had the posters there, displays in some of them, but also receptionists trained up to help people with the forms and then to take the forms off and get them signed and remove that barrier. And then all our other contacts involved through the group and through our wider partnerships all tried to do a little bit really about embedding within our practices. A really key part of that was around doing these bite-sized training sessions. So what happened, and I think this would be transferable digitally. This was obviously in pre-COVID times, but what I did was I went out to a range of groups to do half-hour bite-sized sessions, which I branded as Families and Food Poverty. And it was with a range of frontline workers. So that's everyone from kind of the statutory sector, so with midwives, but also with people like hospital dietitians. I did a really big session with them. But then also in the much smaller community groups, so women's refuges, drug and alcohol projects, food banks, with the Holiday Hunger Project in the city. And we advertised them really as a session where I would go out to you. And again, I'm really happy to share the slides from that half-hour training. I do think they'd need a bit of adapting. Now we're in a new world and we don't need the signature, obviously, but also to be online. But I know most people still have team meetings going on online, and I reckon they'd probably also still welcome a guest. And that worked really well for us. There's some stats on the Food Power website. We've got one of those little snapshotty things. And I also have a little report that I've done. It's still draft, but it's shareable if people want to see a bit more detail. It's also got the comms plan we used attached to it. Again, it's all rough and ready. It's what we used, but we're really happy to share it. I think what was really important about the training is there was a really high uptake for it. People liked the format, that we would go and we'd spend half an hour, and we got really good feedback, really incredibly high feedback on the evaluation we did, about people feeling it was the right length and the right format. And the other thing is that as part of the session, we asked people to make commitments as part of that. So they had to think as part of the session, how can we build Healthy Start into what we do? Can we display a poster is the easiest one. And also really stress the phone number for ordering the application packs, which obviously until we're digital are a really key part. And as I said, I do think that would be replicable online. The other thing we did as part of the session was obviously we linked it into our wider work around food poverty. And I think it was important that although the session largely focused on Healthy Start, we didn't actually brand it as that. I'm not sure people would have been given quite such a big take up if we didn't, just make it a little bit more wide. And we just briefly, as part of the session, touched on things like the holiday clubs, free school meals, the cooking and eating on a budget stuff we do, school breakfast clubs, and also links to our crisis support and food banks. And I partly included that now because I think that would be a really good selling point if you were running something like that, but doing it as an online version now, because obviously, the food crisis is something that everybody's dealing with. So we also borrowed, I said Cambridge borrowed our poster, but we borrowed their quiz, which was fantastic. And that's an integral part of the training session. Obviously our online version of it had things like that, and I've included the slides so everyone can know whether they know the answer. I bet not everybody in the room, even though we all know about Healthy Start, knows that actually obviously the answer to the question is on their 4th birthday, even though we've all talked about it earlier in the session. So that little kind of interactive learning worked really well, just to make people think, oh, I thought I knew the answer to that, but did I? And I've also just included here one of the slides, which I think is particularly relevant at the minute, and I've shared in other contexts, just because obviously with the increase in people claiming universal credit, which has been massive in our city and I'm sure nationally, it's quite helpful, I think, as part of that session to have clarified the requirements around universal credit. So I've just popped that in into the session now in case anybody would want to share that information, as a slide or in another format. So yeah, I was asked to do a very quick session, so to leave time for questions. So that was pretty much the whistle stop tour. As I said, we did quite a lot more, but those were some of the key points. And I think we're just opening it up really to questions for myself and also for Cambridge, for Gemma.
That is perfect. Thank you so much, Emily. Thank you, Gemma. As Sandra wrote, excellent, Emily, as ever. So great to have the breakdown from both of you guys. And it's just really, I love the idea of, I think it was before maybe Gemma was working at Healthy Start, but the using the poster that was developed in Brighton, rolling that out in Cambridge, and then using the quiz that was developed in Cambridge and bringing that into other areas. I put a link in the chat, but Cambridge very kindly let us put the quiz into our Healthy Start toolkit, which is on the Food Power website. I dropped a link in the chat for that. But if anyone wants to see the full quiz and putting it into a PowerPoint form, I think it's really useful for that live interaction. Few questions for Gemma and Emily. If Gemma, you want to come back on and join us, oh, great, you have. Obviously, many people would love to have the resources shared more widely. I know that that poster in particular, and just so many people I've talked to over the last few years have said that they would love to have a poster that they could edit. So I think if that's one thing that the digital service can consider when they're creating branding, is having that poster that has some local information that can be changed for different areas would be great. And with that new branding coming out later in the year. So one of the questions was about, and maybe this applies to both of you, but Rosie was asking first for Gemma if there was any plans to publish this work in a midwifery journal or to share the learning.
I'm not sure how far it went. My colleague Sam actually was responsible for the case study that we've done through Food Power, but I'll definitely have a chat with her because it seems that it could be useful for people.
Great. And there was also a question from Jenny wondering if you'd paid for the adverts on Facebook.
We did, yeah. Nothing too huge. I think it was about £30 for the month.
Okay. And this was from Victoria and might be interesting for Gemma or Emily, but how did you go about sending out to families in the targeted area, or I guess this is for Cambridge, how did you go about sending out to families in the targeted areas given data protection and sending them information or direct marketing in a way that they have not signed up to? Did you have some sort of data agreement in place with the authority?
No, basically we looked at the areas at Cambridge that had low uptake but high eligibility. And then we zoomed in on the streets that were seen as highest in terms of the indices of multiple deprivation and targeted it that way.
Okay. Yeah, Emily.
I'll just come in just to say when we did our 2017 campaign, the people running our local discretionary social fund, which is our sort of local crisis fund, who also manage the housing benefit team, they did a mail out on our behalf. They identified people who would be eligible and posted to all those people. So that got past the data protection, and that was part of the kind of council's contribution to the campaign. I have to say, I'm not sure how totally successful that was because it was quite expensive for them to mail everybody. And I'm not, in terms of doing things on the cheap, I don't know that we noticed a huge response after that, but it was very hard to tell when you're doing lots of different things. But that, just to share, that is a way around the data protection thing.
Yeah, that's a good point. And I know some councils and have databases. I can't remember the name of one, but I know I think Croydon has this. So Chantal, if you're still listening, can help me out with this. But they have databases that signal who is eligible within it, and it's a platform that's paid for. It's quite expensive, but it's something that some councils use with annual subscriptions, and they can see who it is. And so, for example, in Croydon, they were able to directly contact everyone they know who is eligible in their area. So it really depends on the area. But I put in the chat, we've got case studies of all the different groups from Food Power who've been working on Healthy Start. And in there, it's got one of the case studies is Croydon, if you want to read a bit more about that. Sue asked for Emily. She was really liked the Red Book stickers. And she was wondering if you did any digital Red Book version of the marketing, Emily.
I don't quite understand that. So the Red Book stickers were just a sticker that the health visiting team printed out and stuck on the Red Books. I don't know what a digital Red Book is, but I'm not in the health visiting team, so I maybe just didn't understand.
I think
digital marketing, though, I should say. There was obviously a whole Facebook campaign and Twitter campaign.
Okay. I think from what I understand, there's they've made e-Red Books, essentially, like digital Red Books. So I think she was just wondering if there's anything that had been linked to that, like a sticker, but something for the digital version of the Red Book.
Oh, I should say no. I've no idea about that. Sorry, I'd have to go back to a colleague in that team, and this was a few months ago that we did most of that activity. So, but I should say I did get an update from her before this session that the health visitors now, they are continuing to promote. They're doing all their new birth visits and their antenatal visits on online or by phone, and mainly by phone at the moment. But they are continuing to promote Healthy Start through those visits. So I ought to have shared that as part of the session, really. But I don't know about the digital thing, sorry.
Yeah. Well, it sounds like what people are saying is that the online Red Book or the e-Red Book has been rolled out in different areas. And so some people have them and some people don't. So I think it's just as things become more digital, it's about, coming up with an e-sticker for an e-Red Book, it sounds like. Another question that came in for you, Emily, was have you accessed the early years training forums and head teachers bulletins, which are relevant to all 2 and 3 year provision? Has that come up at all?
No, I mean, it was a partnership campaign, so I'm sure those involved, would have done. I was sort of coordinating from a food partnership point of view, so we very much promoted through our networks, through our food banks network, through all the kind of organisations that we're in touch with. But obviously, the way that it worked as a campaign was that those involved in that from across the different sectors also use their routes to promote. So it went in things like GP newsletters and bulletins that go out to schools. And I'm sure some of those involved would have accessed that.
Yeah. There was one coming in for Gemma. Millie was wondering if there was any peer-to-peer promotion of Healthy Start encouraged in your campaign.
Yeah, we did quite a lot through the Cambridge Food Poverty Alliance. So when we had the Facebook campaign going out, the posters as well, and a lot of the partners took Healthy Start forms as well to have at their centres. So I think that was really key to getting the improving the awareness in the city.
Yep, great. I haven't seen any other questions come in through the chat, although someone wave your digital hand by typing something in to let me know if I've missed your question for Emily or Gemma. But are there any final thoughts that you guys would like to add from things we've gone over today? Yeah, Emily.
I just noticed quite a few people said they'd be interested in seeing the slides or our sort of draft report on the campaign with the comms plan attached. I wondered if I send them to you, Maddie, could you perhaps distribute them? Because it might be an easier way for people to access them. Everyone's got your email address and things.
Yeah. If you would like to, what I do at the end of these webinars is always send out an email to everyone who's registered. So not even everyone who's here today, but a wider group of people, and I can include any sort of resources that Emily or Gemma would like to share. And one person put out a suggestion earlier that what I might try to do is type up an FAQ about the presentation from Joanne, so that we can include some information from there too. Joanne, if you press *6 on your phone, you should be able to unmute yourself if you want to say anything in the final few minutes, if that works. Was there anything else, Gemma, or that you wanted to chime in with?
No, I don't think so. This is my first time on this this webinar, so it's been really fascinating and good to learn from others.
Okay.
Thank you.
Thanks. Health visitors is key, even if their signatures no longer did. And to better to help professionally or in terms of connecting with those folks. I am breaking up. Oh, it sounds like my sound is gone. Am I coming back at all?
Yeah, that's
it's
better.
Okay.
Hello.
Did you hear the question I asked? Maybe not.
No.
It was just, okay. One final one from Rosie that I thought was very good was just, she says, seems to me that training midwives and health visitors is key, even if their signature is no longer needed. Any hints as to who best to approach and how to sell to health professional managers?
I think the food poverty angle and the health angle in terms of child poverty, but also young mums, that was something that was of interest to the midwives that we spoke with. And, a lot of these people are motivated by caring for people. And so I think that was probably the biggest incentive for the taking part in the training.
I think I'd agree with Gemma there. I mean, I think I found these half-hour sessions a really powerful tool in connecting with people. And I think the format was really good on that. I was really surprised at the high level of uptake, and it was a really, and I think I think it would be a good time to develop something like that now, because we're all just getting used to online meetings, staff meetings, and I'm sure they'd love to get something different happening at those. There isn't a lot of stuff out there, is that nobody else has approached me and said, would you like me to be part of your team meeting? It seemed to be an unusual thing even when we had physical meetings. So I reckon that would be a really good way to do something similar now. And I think now more than ever, I think everybody who works with families is really concerned about the high levels of need out there, and also what happens next once we've gone past this sort of emergency phase. There's a lot more new people coming on board who are struggling. So I think it would be a perfect time to frame something like that in terms of families and food poverty.
Yeah, I think, sorry, I might have just stalled out there again. I was just trying to see if we could, I'm just going to see if Joanne wants to be able to join in once more to see if she has any final thoughts. We'll give her a second. There was some good chat of people just saying that public health, local counselors, and infant feeding teams have been really useful coming in. And I think really driving home Emily's point that you had just so much demand. That was really impressive and kind of surprising to you for your bite-sized sessions, and really learning that that seemed to be an incredibly useful way of reaching out to people and saying you'll come to them. I mean, assuming someone has the capacity to go and do that. I think, Joanne, are you back on the line with us?
I am, yes.
Great. Did you have anything, final thoughts that you wanted to share just before we wrap up here in the next few minutes?
Just really, I just wanted to say another huge thank you for inviting me to present. This is my first webinar like this that I've done. It's been really, really useful hearing what the other ladies have had to say. Hopefully, everybody's going to give us a hand and send any questions and offers of help to the email address. But it's been really, really great, and I look forward to the next one.
Great. Yeah, thank you. I think it's really encouraging for everyone to hear how open you are to feedback, and to say that, it's really coming across that the NHS BSA really wants to make this service the best it can be for everyone who's both working to promote it, and for, most importantly, for the families who are receiving it. So trying to make that a smooth, streamlined process as best that can be within the scope of the digital project, which I know is has its limits in terms of things like eligibility. So we can't expect you to have all the answers, even though I think everyone here today really tried to get it all out. So that was great. Well, in that case, thank you so much, everyone. I'm going to leave the chat open for just a few more minutes, because I know that some people are still kind of having a bit of a conversation there. Again, if you want to exchange any contact information or links, please go ahead. A final very, very big thank you to Joanne for joining us from the NHS Business Services Authority, to Gemma from Cambridge Sustainable Food, and to Emily from Brighton and Hove Food Partnership. We know this is a very, very busy time for so many of the people who are on the call, and we really, really appreciate you taking the time to join our webinar today. And for everyone who's attended and pitched into the chat, it's one of my favorite things about these webinars is having so much action in there. So we appreciate you for being such an engaged audience today. I'll be in touch in the next day or two. I'm going to try to really type up a lot of these notes for everyone beyond just the usual things we do, since I think there was an above and beyond amount of information that was shared today that I know is really pertinent to a much wider audience than those who are able to join. So bear with me for a few days, but please help spread the word and get in touch with Joanne if you'd like to feedback any more and help them reach out to more people during this. Thanks so much.
Thank you.
Thanks, Maddie.
Thanks, everyone. Bye.